the water molecule that is affected, yeah, starts to vibrate. Yeah? But it doesn't vibrate like in a microwave. Yeah? So not the entire molecule vibrates, only the so-called vibration bands, which is a vibration between the oxygen and the hydrogen molecules. They vibrate.
Hi.
Hello, Serena. Nice to meet you.
It's so lovely to meet you, Hans. Thank you so much for your patience in finally connecting here live with our audience, who is amazing. Dave and I just got off with a few thousand people, maybe it was a couple thousand people, who are so engaged in what they can do to optimize their health, unlock their potential, and just, sort of give themselves the best opportunity and possibilities to live the best life. So you're talking to a very warm audience here who loves all of this. And thank you for being here today.
Thank you for having me. And I hope that we can bring the information over that your audience and you are looking for. Yeah, understandable, easy, and memorizable. Yeah.
Yes. So, okay. So people got to peek a little bit. I will try to turn my camera again, but it's all set up on this thing. Everyone, you can go to my pinned comment here in the bottom, and you can see the account for ENG3 Corp, and go there and give them a follow. You'll see the device that we're talking about. You'll see some of their other products as well. You've seen it here. You've seen it on my account. You've seen it on my blog. This is the machine. If you have been following, you know exactly what I'm talking about. And here today, we get to talk to the founder. And Hans, I'd actually love for you to give us your story first. You come from such a background, and it's been this beautiful journey, and you've created this incredible product that heals and optimizes people. So can you kind of give us a little bit of that background first before we kind of dive into how you created it?
I'm happy to do this. Yeah. You mentioned in the introduction that my background is material science. Yeah? And with this background from the university, I went and got my first work always in medical device companies. Yeah? And the first one, that was a medical device company in Berlin, in Germany, that produced human implants. They designed and produced human implants like hip joints and knee joints. Yeah.
Wow.
So really in the first stages of those kind of technologies. And later, the company got bought by Johnson & Johnson and got bigger. Yeah. And it was a big collaboration in the different Johnson & Johnson branches in the UK and in the US. Yeah. So, and I was a part in different departments. Yeah. One, because of my background of material science background. Yeah. So I was, for example, also part in the R&D group. Yeah. That was interested in to find out what is the best kind of surface prosthesis could grow in. Yeah? What is being accepted by the body as a product to stay in there for a long time. Yeah? And so that was then the beginning of looking into cell biology. Yeah. So how is the cell working? What cells make working? Yeah? So, and the most important molecules in the cells are the proteins. Yeah? The proteins are the workhorses. They decide what the cell is doing. Yeah. And so it was very fast to figure out that proteins are material science. Yeah? That is not chemistry or anything like this. Yeah? That is material science. Yeah? The building blocks of the proteins are the amino acids. They have to get put together in chains. The DNA basically tell the amino acids what kind of chains they have to build. And those chains, after they're forming sheets, they have to fold. And this folding process is physical process, not a biochemical process. Yeah? So that was all material science. That was one thing where I was working in this department for many years. Yeah, and we learned the understanding of cell biology, yeah, and the proteomic was a new area, yeah, understanding how proteins are working. And when I decided to, then I started my own medical device company in Berlin for human implants, yeah, which was very interesting because this company was able to be a subcontractor of many other implant manufacturers worldwide. Yeah. And then I wanted to go forward and apply the knowledge out of my cell biology experience, yeah, into new products, yeah, which means products that help us to become a prevention tool, yeah, so that this knowledge could come a prevention tool instead of only a repairing tool. What we were doing a lot of things in the medicine, yeah? Especially out of this area where I came with implant medicine, that is only repairing after we had a problem. Yeah? So I was more interested to go in the direction of preventional medical things. So keep people healthy, get them healthy again, yeah, and protect the body. Yeah? And so that was basically then the reason why I used the knowledge out of my proteomic background and turned this into a medical device. Yeah? And of course, additional something else was necessary to learn from me, yeah, and that I did in the last 20 years, you could say, yeah, and that is water science. Yeah? Because that was always a question in the proteomic field, as in the protein science. Yeah, what makes the proteins folding? Yeah, the proteins are, you could say, they're floating around in the cellular water. And the folding process, what makes it? What triggers the process? Yeah? And there was 100 years ago, there was already the assumption. They said that the water is responsible for it. Yeah? The water has to change a certain its property, yeah, and when it changes the property, then it will affect the protein and trigger the folding process. So interesting was then for me, I moved to Seattle, yeah, to the West Coast, and then years later I recognized that the center of water science is in Seattle at the university here. Yeah? So I looked in and worked together with people, become part of the scientific area worldwide in water science. Yeah. Today, we work with a lot of those institutes and universities in this field together, yeah, to learn more and see how we can apply their knowledge in advanced technologies for the future. Yeah. So these two things were basically the reason, the understanding of the proteome work, how they work, and the understanding how water works. Yeah? And when you apply knowledge out of these two fields and you combine correctly, and then you do studies, you prove that this, what you apply there is working, yeah? Then you can actually create, like we did, the NanoVi device, which is now a registered medical device in different areas in the world. Yeah? Then you can finally have such a successful product available for users.
It's amazing. It's an incredible journey, and just your inspiration, your sparks of inspiration from the background that you've had in the material sciences, and then the proteomics, and then your love for water science. I think there's a lot of people here that still it doesn't totally connect for them. How does it work? When you built this machine, how does it work? How does it take this distilled water? What is it doing? When I put this in my nose and this distilled water goes inside, what's in the machine? And that's proprietary, so you're not going to give us, the specs and make
I
up this
can go,
thing.
yeah, I can go deep into this. I'm happy to do it. But let us go for a couple of sentences back to the proteins, which are in our body and so important for us. Yeah? The protein folding is being triggered by a certain stage of water molecules on top of the surface of proteins. Yeah? So the proteins are really small components, really, really small components. Yeah? We barely can see them with microscopes. Yeah? Some of them are so small, we cannot see them with microscopes. Yeah? So, but we know they have a surface. Yeah? And when an unfolded protein, which is basically a chain, yeah? a chain that floats around, when a very thin coverage of so-called ordered water molecules are piling up on the surface, when enough of these are piled up, then the order switches. The higher order of the water switches into the protein, so the protein folds, and the water that had the higher order will lose its order. Yeah? So that is a thermodynamic law. It's called change of entropy. Yeah? We are surrounded every day by a lot of change of entropy events. We don't even recognize it. Only people who studied maybe physics recognize it. They say, okay, change of entropy. I heard it. Yeah, usually you can hear. Yeah? Anything that has to do with an explosion, so everything that is kind of noisy, is probably a change of entropy. Yeah? When that happens in the cells and with the proteins only, it doesn't make noise. It's simply too small. Yeah? So these higher ordered water molecules are getting produced usually in the cells in the body. Yeah? We need a certain amount. If the damage is higher and our body demands more protein build, then the body lacks a little bit to keep up with the amount of water that need to be produced. So and that is called aging. Yeah? We cannot keep up the repair. Yeah? So today in water science, we know what is necessary to happen to the water so that water builds out on surfaces the higher order. Yeah. So what in simple words said, very specific electromagnetic energy is being absorbed by water. Yeah? When that happens to water, yeah, then now we go. I will go a little bit deeper now in the terminology.
Yes, please do. We've got over 4,000 people on here who want to know have been waiting for you to go deeper. Well, not for you personally, but for waiting for me to bring you here to go deeper.
Okay. When water absorbs electromagnetic energy, yeah, the water molecule that is affected, yeah, starts to vibrate. Yeah? But it doesn't vibrate like in a microwave. Yeah? So not the entire molecule vibrates, only the so-called vibration bands, which is a vibration between the oxygen and the hydrogen molecules. They vibrate. Yeah.
Okay, let me stop you right there. Let's give everyone a visual of what's actually vibrating, because people are going to visualize the whole molecule. So what's actually vibrating? The bands between.
Yeah. Let us say, how can I make this easy? The water molecule has two atoms, H2O, yeah, oxygen, and one atom, hydrogen. Yeah? And they are connected with so-called vibration bands. Yeah? When these guys are vibrating, not the entire three molecular object is vibrating, only these bands are vibrating. Yeah? But because only the bands are vibrating, the molecules are not rubbing on each other, so they don't create heat. Yeah? Like a microwave. Microwave, you put electromagnetic energy into the water so that the entire molecules are starting to rub each other and get warm. Yeah? We don't want this. Yeah? And that is not the purpose for this. Yeah? We only want that the vibration bands between the atoms are vibrating. When they vibrate on one molecule and the next water molecule is close enough, then the next water molecule will start to vibrate too. It will do the same thing. Yeah? They don't have to touch each other. They do the same thing. Yeah? So what I always try to say, bring a little example in. Yeah? For example, you are in a big football stadium. The people, the audience are sitting all close by each other. Yeah? If you would push one, they would connect to each other. They would hit each other. We don't do this with our technology. We do something more like you know the wave when people lifting their arms.
Yes.
Yeah. So some people start. The neighbor will do it. The neighbor will. They affecting each other without touching
Mm.
each other.
Mhm.
So that is a coherent domain.
Mhm.
Yeah, coherent behavior, and that's
Yes.
to the water molecules when they accept a very specific electromagnetic energy. They
Mhm.
behave in the coherent domains, and
Oh.
those two coherent domains, they travel through the entire body of water. Basically, you said it doesn't matter how big the soccer stadium is or the football stadium, everybody will do it.
Yes.
Yeah.
Yeah.
So when this wave that runs through the system runs against the surface, yeah, we have a surface that cannot go further, it pushes the water molecules together.
Uh,
So,
okay.
and when
Okay.
they are getting pushed together, yeah,
Mhm.
then they have a higher order. That is called a high order.
Mm.
Yeah? So, and you know this also a little bit out of out of everybody's life. You're in a room, in a really packed room.
Uh-huh.
Yeah? So a lot of people there, but you don't really want to touch each other. Yeah? Everybody would like to have a little bit freedom. If you look around, the people who are staying along the walls of the room, they're staying close
Ah.
together.
Uh-huh.
They're they
Yeah.
got moved closer together, but
Ah.
not because they were pushed physically together,
Ah.
only because they wanted to stay out of the range of the others. Yeah.
Mhm.
So that is something like this. Yeah. That is how the higher order is being built.
Huh.
When that is being built up on the protein, then the protein will fold. Yeah. So what we
Mhm.
do in our technology is now we have to connect the proteins in your body
Yes.
to the point where we emit the electromagnetic energy in the device.
Mm.
Yeah. And that could be 3 foot long distance. Yeah. So how do we do it? We have to create a very specific humidity between the point where we emit the electromagnetic energy in the device to the point of your mucous membrane, your inner mouth or your nose. Yeah.
Mhm.
And we use minimum 80% humidity. So for the water molecules, it is close enough
Right.
so that the Iola waves can go through the water thing, so that the coherent domains can travel to the water.
Mhm.
So that is the only thing. Yeah? You have to, the humidity only has to touch your mucous membrane
Huh.
because our body with our cells, we are like a cloud. We
Uh-huh.
are mainly water molecules, but not droplets. Therefore, the cells are too small.
Mm.
We are like a cloud. We are like a bag of high humidity. Yeah?
Huh.
Yeah.
Uh-huh.
So when we emit the electromagnetic energy in our device to the humidity, that creates a coherent domain that travels at extremely fast through the entire humidity that is created in our device, touches your mucous membrane, and from the mucous membrane, it travels to your entire body. And
Hmm.
here again, doesn't matter how big you are. You
Yeah.
could be a small person, a kid. You could be a size of 2 elephants.
Mm.
Yeah? It will always travel through the entire system and will touch all surfaces in this water.
Yeah.
So I hope that was not too complicated and too much.
No, that was incredible because you really walked us through the process and the visual um of how it works, how the device works from sitting here wearing it to how it connects to our proteins, our
Mm.
cells. So that's and why it works no matter what size you are,
Yeah.
whether you're
Mhm.
an animal or you're a person,
Mhm.
Um so okay, so there's something that you guys talked about, like you have all these different studies, which I would love to shine a light on. There's been clinical trials and there's been so many studies that have shown evidence, and I know it started anecdotally, but evidence to how this works. Can you share a little bit about that? Because I know that based on the studies, there are user groups that you guys have sort of organized to make it easier for us, for the
Mhm.
and the consumer.
We have basically two areas for studies. One is a technology study,
Yeah.
where we have to prove, and we would like to learn out of it, how many or how much of the coherent domains do we create? When coherent domain travel, how far can they go? Will they create on surfaces the ordered water? So that is all kind of material science, water science, and technology science. That is what we do with institutes who have the special measurement equipment and the special background of doing it. Currently, we are doing it with an institute in Italy. They are advanced in those areas, and they do studies for others too in this field. So that is one group. The other group is then studies to show how the proteins are being affected by it, when that actually happens. So we have proteins showing that regular proteins, that they start to work better. So we have damaged proteins. We could show that the damaged proteins are being repaired again. And we could show that proper working proteins, when they got treated with it, are better protected against damages. So, and these are the three areas that we figured out, that we were shown, and we have peer-reviewed publication about it, and there are different proteins that people use for study on it. Then we have to translate this to the audience, to the user groups. So we have basically two things. One thing is proteins are working better. They are higher cellular activity. That is an area, for example, in the performance field. Mental or physical high performance are looking forward that their body, their system works better, faster, and those things. So that is a huge group. There's a professional sport area that is a corporate area, and those
peak performers, where there's peak performers on every level in different industries.
And that could be exactly mental peak performance very often. Then we have the group who would like to utilize the protection of the proteins that they don't get damaged. And that is a whole area of anti-aging, wellness. I would like to stay there where I am. I don't want to get more age-related problems or anything like this. I'm happy where I am. I would like to stay here. I would like to protect this thing. I will not. My interest is not to turn into a high performer or anything like this. So that is an entire group of wellness, anti-aging, and the other one is a group where we can prove that protein functions are being reinstalled after they got lost. That is the health area, where we have people with age-related disorders or chronic diseases, and they can see if they can reinstall the protein functions that their body lost. Because we have always to remind the protein that our body needs, the information is in our DNA. The DNA will not lose this information. It's only a question, is the little tiny cell or the cellular area where it is necessary to do something, is it possible to turn a certain biochemical process on or off, or can it do both? And when it was not able to do this anymore, a certain kind of biochemical reaction, then we can recognize it as a loss of function. And they are loss of aging. Aging is the same thing. Because we accumulate more and more damages. That is basically aging.
Yes, of course. A lot of the work I do with David is, is exactly what you're saying here: turning it on, turning it off. There's been quite a few questions, and I know we're coming to the top of the hour. I'd love to know if you can share, or if it's okay to share, the type of dispositions and specifically illnesses that have been treated through this method in the machine. I'm not sure if you can say that yet. You guys are going through an FDA process or not. But if you can share, or what you can share, That's one of the questions, and it actually came through before we even went on live. I was messaged that.
Yeah. So as a medical device, yeah, we don't cure diseases. Yeah.
Right.
So because medical devices don't cure diseases, we cannot claim certain things.
Mhm.
Yeah. And because it wouldn't be allowed to claim a certain things, we don't even do the studies for
Yeah.
it. Yeah.
Okay.
But like all medical devices, we are a tool for the physicians, for the healthcare takers. Yeah.
Yes.
And they have the possibility to work with different individuals and then to decide what is the best tool for them to get better. Yeah.
Yeah.
And so we have a lot of feedback from those professions out there where with whom they use this technology and what kind of success they have. Yeah.
Mhm.
So there's a certain area, for example, wound healing is a big thing. Yeah. So
Absolutely.
what is wound healing doing, or what is the purpose of wound healing in certain areas? One thing is, yeah, you had an accident, would like to recover faster. Yeah. The other big area where you have wound healing without a health problem is, for example, cosmetic surgery. Yeah. You would like to have a fast recovery. Yeah. So now we are already in this area fast. Yeah. You would like to be a high performer. You would like that your body is a high performing
Mhm.
system in this moment. Yeah.
Mhm.
So your body is pretty much doing this what athletes are doing. Yeah.
Yes.
Running a marathon every
Yeah.
week until you recover. Yeah. So those people are using then the devices exactly for this to accelerate the healing process, because faster wound healing means less risk of infection, yeah, better healing outcome, yeah, better visual outcome and those things. And we have a lot of dentists, for example, who are using this with their clients for faster wound healing. Yeah? Because the
Absolutely.
wound in your mouth, you cannot cover it, it's
Mhm.
exposed to everything. Yeah, you have a high risk of infection in your mouth. Yeah?
Yes.
So they use it with wound healing. And then we have the users who would like, the medical users who would like to use it with their patients who have all kind of metabolic problems. Yeah, metabolic problems means certain components are not being utilized.
Yes.
Utilized, they are not chemical utilized. Yeah? So the utilization, so the biochemical process is controlled by proteins. Proteins decide to turn something on, to turn something off. Yeah. So when you can reactivate those proteins to do things, you will see immediately the benefit. Yeah.
Yes.
Yeah.
Yeah.
For example, people said very often they would like to have more energy, cell energy. ATP is
Mhm.
necessary. Yeah. ATP is a long, long chain of protein events
Yes.
until it is ATP.
Right.
I mean, the last thing is the enzyme, the ATPase in the mitochondria
Right.
that produce ATP. That is the last thing. An enzyme is a protein. Yeah? Why are older people more likely not to produce cell energy? This ATPase, this enzyme, which is located in the mitochondria, is
Mhm.
exposed to constant free radical damage.
Yes.
Yeah? And
Yes.
if you do it long enough, many, many years and a huge amount, you will damage this little protein. Yeah?
Right.
And then you cannot produce ATP.
Right.
But usually, I say in a lot of situations, it is not the only fact. Yeah. We have so many other proteins that are involved from the exchange in the lung tissue so that the oxygen gets into the blood to the hemoglobin that transports the oxygen. And there's
Absolutely.
another protein at the cellular level who said, okay, leave the oxygen here, come in oxygen, then the oxygen has to be transported to the mitochondria. So in all those things, there are all proteins are involved. Yeah.
Yes.
And it is very nice to see sometimes that people who have low oxygen saturation, so something
Yes.
in the entire oxygen transport doesn't work. They're a little bit gray
Yes.
and not really active looking. Yeah? And they use our device, and while they're using the device, you can see how the oxygen saturation goes up.
Yes.
Yeah? So they
Yes.
have more oxygen in the blood. Very often, if that's possible, the ATP can be produced, and
Yes.
that all without providing more oxygen.
Yes.
Yeah? Because we pretty much
It's
have enough
incredible.
oxygen in the air.
Yes.
Yeah? Mhm.
It's incredible.
Yeah.
You know, uh, there's so much more. Do we come on again next week, or it's with somebody else? And I know there's so many more questions, And Hans, you've just been amazing. I need to talk to you more offline as well. I have tons of questions,
Yeah.
and
Hmm.
we'll have to do this again because I didn't even get I didn't even get a chance to ask my questions. But just to address the audience, first of all, you guys are amazing. A lot of you guys were on with me in the last live with David. There's 6,000 of you on right now. That's just amazing. I love that some of you are talking with each other about what there's some of you that own the machine and talking to each other about whether how the machine works for you. I'm so grateful for you guys and this community and how you share and support each other. This absolutely, there's so much I can say about this device. It's helped me, you know, obviously our fur babies, when everything from cognition, I have long COVID. I've been very vocal about it since, March of 2020. I've had a TBI, and I've used this with different clients. I mean, it's just everything. Patients who have cancer, it helps them process through the side effects of chemotherapy. I can say this, Hans can't, but I can say anecdotally, these are the experiences I've had as a practitioner. And yes, Gizmo is a perfect example. He's got a hard time with his heart. He's got congestive heart disease is not progressing to failure. Maybe we can take that back a notch. And so sometimes he doesn't get enough oxygen into his system. And we see his little tongue is not pink. And we give him the nano. We have it, we stick it in a cone. It's like we
Hmm.
tent him. And he literally comes back to life. It's nourishing. It's like food for your cells and your soul. So I love this. Thank you so much, Hans. Thank you
Hmm.
so much to all of you. If there's more that you guys want to know, absolutely. Um, send messages. Send messages to Hans, send messages to the company, send messages to me. Maybe we'll do another one of these if you guys really enjoy it. I would love giving you guys information, educating you guys so that you can educate your communities and each other, especially when it comes to devices that really they heal, they enhance our health and the health of the ones we love. So thank you so much for creating this, Hans. You are one of those earth angels.
Thank,
And thank you for coming on today.
thank you very much, Serena, for having me here. And of course, I would be available for you and your audience if you want. Mhm.
Amazing. Thank you so much. Thank you guys so much. And thank you to all those who came on twice. I so appreciate you. And I will see you guys next week very soon. All right.
Okay.
Bye.
Bye.